You know, for so many breast cancer survivors, ringing that bell at the end of treatment, it feels like the finish line, right? But what if it's not? What if, for a lot of people, it's actually the start of a whole new journey? One that's filled with some really unexpected challenges that, honestly, almost no one talks about. Today, we're going to walk down that hidden road to recovery.
Just let that sink in for a second. This is something a patient said to their therapist, and you know what? It's heard way, way too often. It just perfectly captures this silent problem happening among survivors. Really common, totally manageable side effects that patients are just never told about. And it leaves them struggling with pain and confusion all on their own.
So you've done it. You've finished all the treatments, the cancer is gone. But then, a new problem starts to show up. We're talking about chronic soft tissue changes, things like scarring, pain, and its stiffness that can really seriously impact your quality of life.
And these problems? They actually have names. They're not just some random aches and pains from getting older. Nope. They're symptoms of two very specific but very frequently overlooked conditions that can happen after treatment. So let's break them down. Okay, so here are the two big ones. On one side, you've got radiation fibrosis syndrome, or RFS. The easiest way to think about this is like internal scar tissue that just kind of goes haywire after radiation. It makes everything feel tight and stiff. And on the other side, there's axillary web syndrome, or AWS. People often call this cording, and it literally feels like tight, painful guitar strings running under the skin in your arm. The good news? Both are manageable, but only if you know they exist in the first place.
So just how common are we talking? Well, get ready for this. That axillary web syndrome, the cording we just mentioned, it can happen in up to 91% of patients after certain lymph node procedures. Let me say that again, 91%. That's not some rare side effect. For some people, it's practically a guarantee. And yet, it's still one of the least discussed parts of recovery. It's wild. Which of course brings up a huge question, right? If these conditions are so widespread, why on earth do so many patients feel like they are the first person to ever hear about them? Where's the disconnect here? What's going on? And this slide right here perfectly shows the problem. This is a real patient's plan of care. And look, follow-ups with surgical, medical, and radiation oncology, they're all scheduled. They're mandatory. But what about physical therapy and the certified lymphedema therapy that can help? It's listed as available if needed. It's treated like an option, not a critical part of the plan. And that is the core of the problem. It flips the whole system from being proactive to being reactive. Instead of preventing these issues before they start, the system basically waits for patients to develop a serious problem, and then they have to ask for help, often for a condition they didn't even know they could get.
But here's the good news. There is a solution. There is a specific, incredibly effective therapy that can deal with both RFS and AWS and all the swelling and pain that comes with them. But it requires a specialist, someone with a very, very particular set of skills.
It's called manual lymph drainage, or MLD. Now let me be clear. This is not your typical deep tissue massage. It's an incredibly gentle, rhythmic technique, and it's designed for one thing: to stimulate your body's lymphatic system, which is basically its own waste removal network. The whole idea is to manually reroute fluid around any blockages from surgery or radiation, which brings down swelling and pain. This chart, this is a fantastic aha moment, because it shows you just how different MLD is. A traditional massage, right? It uses deep pressure to get at your muscles. But MLD uses incredibly light pressure, just enough to stretch the skin where those tiny lymph vessels live. There's no oil, and the sequence is absolutely critical. It always has to start at the neck to clear out the central drainage point first. So you see, there are completely different therapies with totally different goals.
And the benefits? They line up perfectly with the problems survivors are facing. MLD is proven to decrease swelling. When you do that, it reduces pain, which in turn increases your range of motion. I mean, think about how huge that is for someone dealing with cording or fibrosis. And on top of all that, it's deeply relaxing and can even give your immune system a nice little boost.
Okay, so MLD sounds pretty great. But listen, this next part is maybe the most important takeaway from this whole explainer. You can't just go to any massage therapist. Getting the wrong kind of bodywork done on a compromised lymphatic system can actually make things worse. You have to find the right hands.
This quote says it all, loud and clear. Just because someone has a license to perform massage does not mean they are qualified to do MLD, especially for post-cancer care. It's really like asking a general contractor to perform open-heart surgery. I mean, sure, they both work on a complex structure, but the specialization is worlds apart. And here is the wow moment that really drives that point home. Just look at this chart. A standard massage program, it might include, 8 to 25 hours on the lymphatic system? But to become a certified lymphedema therapist, a CLT, that requires a minimum of 135 hours of intensive, specialized training. The difference in knowledge and skill is it's massive.
So, what should you be looking for? It all comes down to the letters after their name. The gold standard is CLT. That stands for Certified Lymphedema Therapist. You might also see CMLDT, which is Certified Manual Lymphodrainage Therapist. These are the credentials that truly matter.
So how do you find one of these amazing people? It's a pretty simple 3-step process. First, look for those letters, CLT or CMLDT. Second, use the online directories from trusted organizations like Lana. They're a great resource. And third, don't ever be afraid to interview a therapist. Ask them about their training hours, ask where they studied. Your health is absolutely worth that extra question.
So we'll end on this thought. If you or someone you love has been through breast cancer treatment, maybe it's time to take another look at that care plan. Because the key to managing pain, to regaining motion, and to really truly getting your quality of life back, it might just be hiding in plain sight, in that one little line item that was dismissed as just optional.